Malabsorption syndromes. So, malabsorption syndrome is defined as inadequate assimilation of dietary substances due to defects in digestion, absorption, or transport. So, in general, when there is malabsorption present, it will affect uptake of proteins and/or carbohydrates and/or fats, fat vitamins or minerals, water-soluble vitamins, and ultimately, this causes excessive fecal excretion, and it will produce nutritional deficiencies over time as well as GI symptoms. Remember, with assimilation, we have 3 stages of assimilation in our digestion process. We have digestion itself, which is the breaking down of large molecules in the lumen of the intestines, the absorption of those molecules across the intestinal mucosa, and then the transport of these nutrients via the lymphatic system of the body. Well, malabsorption can occur when any one of these phases are impaired. As for etiologies, malabsorption has a number of etiologies. And the general symptoms that we see with malabsorption syndromes include chronic diarrhea, and this is the most common symptom, regardless of the type of malabsorption syndrome. Steatorrhea, the fatty, foul-smelling, greasy-looking stools, is the hallmark symptom for fat malabsorption syndrome. Then we can also see symptoms including abdominal bloating, excessive gas, unintentional weight loss, and the unintentional weight loss is the result of nutritional deficiencies. And so when we're looking at an overall clinic presentation, when a patient presents with a history of chronic diarrhea, unintentional weight loss, and if they've had a long-standing history of intermittent anemia, for example, we have to consider malabsorption until it's been ruled out. So we have several forms of malabsorption syndrome. On the list on this slide here, I show carbohydrate intolerance, lactase deficiency. Please note the lactase deficiency actually is a type of carbohydrate intolerance. In addition to that, we have celiac sprue, tropical sprue, and Whipple's disease that we're going to discuss. So before we get into the lactase deficiency or the lactose intolerance, just a little bit of general information about carbohydrate intolerance because it's a general category. And it's defined as the inability to digest certain carbohydrates due to a lack of one or more intestinal enzymes. And the common symptoms we see with carbohydrate intolerance include diarrhea, abdominal distension, and flatulence. Now remember, disaccharides are normally going to be split into monosaccharides in the small intestines. So when we have undigested disaccharides present and they're not broken down, these undigested disaccharides are going to produce an osmotic diarrhea, number one. Secondly, we will see bacterial fermentation of these carbohydrates in the colon that will stimulate the production of excessive gas that results in the flatus, the bloating, as well as the distension with abdominal pain. So lactose intolerance or lactase deficiency is defined as the inability to digest lactose due to the lack of the enzyme lactase. This is our most common form of carbohydrate intolerance. We can see this in approximately 80% of African Americans, Hispanics, and almost 100% of Asians are unable to digest significant amounts of lactose after childhood. Now, 80 to 85% of Caucasians of Northwestern European descent, they're able to produce lactase throughout their life, so they're able to digest milk and milk products readily. Lactose intolerance can often be diagnosed with a careful history and paying close attention to symptomatology with exposure to milk products. The signs and symptoms of lactose intolerance include borborygmi, bloating, flatus, nausea, diarrhea, abdominal cramping. And the key with this is that the signs and symptoms will typically start to occur within about 30 minutes of ingestion of foods that contain lactose. Lactose intolerance treatment involves avoiding lactose-containing foods. And folks, there's a lot of foods that have lactose in them. Not only the most common ones or the most obvious ones that include like milk, dairy products, ice cream, yogurt, sherbets, cheese, milk chocolate. Some things you might not think about would be stuffing, breads, margarines, some salad dressings, candies, and we can even have lactose in certain medications. So this is a problem if they don't have the enzyme. Now, patients can usually be helped with taking things like Lactaid or maybe making some substitutions like soy-based milk, almond milk, coconut milk. Also, these individuals may require calcium supplementation due to their dairy restrictions. Celiac sprue. This is also known as non-tropical sprue, gluten enteropathy, as well as celiac disease. Now, this is an autoimmune disease, and it's caused by an intolerance to gluten, and it results in mucosal inflammation that produces malabsorption. When the mucosa become inflamed, you're not going to be able to absorb nutrients across the mucosal layer. This is a hereditary disorder. It's caused by a sensitivity to the Gliadin fraction of gluten, and this is a protein that is found in wheat, rye, and barley. Again, it is found in wheat, rye, and barley. Rice and corn do not contain gluten. There is no typical presentation for this condition. It may present as early as in infancy, especially right after a child's introduced to cereals in the diet, or it may not present until adulthood. Possible presentations in infants include difficulty growing, and it will lead to a failure to thrive, so they'll be smaller than what they should be for their age. Stools will often be very soft, bulky, clay-colored, and they'll often be very odoriferous. Now, in older children, they may present with anemias, and they don't tend to grow normally. In adults, they'll often complain about issues with lassitude, so a generalized weakness, almost a weariness or a listlessness. They feel exhausted all the time. There may be generalized weakness, anorexia. However, diarrhea is usually the presenting complaint of the patient when they seek care. Associated conditions that can be seen with celiac sprue include the development of dermatitis herpetiformis, and this is an intensely pruritic rash, and it's symmetrically distributed typically over the elbows, the knees, the buttocks, the shoulders, as well as the scalp. Almost sounds like similar to the presentation we see in a psoriasis presentation, for example. The following 3 slides are visual examples of this. In addition to the dermatitis herpetiformis, other associated conditions include diabetes, thyroid diseases, as well as iron deficiency anemia. The treatment for celiac disease is a gluten-free diet. That means no wheat, no rye, or barley. That means the individual is going to have to become educated about what are in the ingredients in the food they're eating. So they're going to typically have to avoid things like commercial soups, sauces, ice creams. Hot dogs will use some form of gluten in their ingredients. Also, makeup can contain gluten. Soy sauce, low-fat and non-fat products like licorice and jelly beans, for example. And it's important to look at labels because items like unidentified starch, modified food starch, hydrolyzed vegetable protein, often abbreviated as HVP, hydrolyzed plant protein, HPP, texturized vegetable protein, TVP, binders, fillers, excipients, extenders, malt, vinegars. These are all terms that indicate the presence of gluten in ingredients. Now, the response to a gluten-free diet is usually rapid, and the majority of people will have symptoms fully resolve in about 2 weeks. If a person that has this condition ingests even small amounts of food that contain gluten, it can induce relapses. Also, a lot of times these people will require supplementary vitamins and minerals. Now, the mortality rate with celiac disease is about 30% without a gluten-free diet. It's less than 1% with a proper diet. Tropical sprue. Tropical sprue is an acquired disease of unknown etiology. Now, it's thought to probably be related to some kind of bacterial, viral, maybe parasitic infection, or maybe from rancid fats used in cooking. It's thought it may even be maybe from a chronic infection of the small bowel by some strain of coliform bacteria, but it's still not known at this point. It's chiefly found in the Caribbean, southern India, and Southeast Asia. It can affect both natives and visitors, although it's rare if the visit is less than 1 month in length. So when we look at symptoms and signs, acute diarrhea is common, as well as steatorrhea. In fact, steatorrhea is more common with this condition than it is with celiac sprue. In addition to the diarrhea and steatorrhea, patients can exhibit fever, experience malaise, nausea, anorexia, as well as abdominal cramping, fatigue, peripheral edema, and they can also have problems with unintentional weight loss due to nutritional deficiencies and the development of glossitis, which is tongue inflammation, and stomatitis, which is inflammation of the mouth mucus tissue. Typically, tropical sprue tends to be suspected in people who live in or have visited those areas where the disease is endemic and develop a subsequent macrocytic anemia. Treatment for this is typically antibiotics. Whipple's disease. Whipple's disease is a rare systemic illness that's caused by the bacterium Trophema whipplei. Now, the main symptoms and signs that are seen with Whipple's disease include joint pain, arthritis presentation, unintentional weight loss, diarrhea, abdominal pain again, cough, as well as pleuritic pain and fever. Diagnosis of this disease is through small bowel biopsy, specifically biopsy of involved lymph nodes reflecting specific histological changes. The main protocol treatment for Whipple's disease is antibiotics for 1 year. Protein malassimilation. Now, when there's a protein deficiency, this results in edema, diminished muscle mass, as well as a decrease in the immune system response to infections. A couple of terms for you to be aware of. Marasmus is the term for protein and calorie malnutrition. Kwashiorkor is for protein malnutrition only. Short bowel syndrome. Short bowel syndrome, abbreviated as SBS, results when there is a surgical loss of 2/3 of the small bowel, and this is going to produce malabsorption. Now, this is usually due to surgery from Crohn's disease, mesenteric infarction, malignancies, volvulus, or congenital anomalies. The symptoms are going to depend on the length of the bowel that's been removed and its function, as well as the level of function of the remaining small bowel. Diarrhea is present and it can be severe, as well as nutritional deficiencies are common. The treatment for this condition includes small feedings, antidiarrheal medications, vitamin supplementation, and sometimes intestinal transplant will be performed. All right, everyone, this is where test 2 material ends.